Okay, let's talk about iron and what's going on when your medical doctor tells you that your levels are normal. So one of two things could be going on. So one could be that, in fact, you do have normal iron. The more likely scenario, to be fair, is that they're low, but the way that your medical doctor is reviewing or looking at the reference range is different from how we view it. And we know that if you're hovering around the bottom half, most definitely, it's likely that some of your symptoms are related to the low iron. Now, with that said, when I'm referring to iron, I'm talking about your ferritin. Some medical doctors aren't even running ferritin. They're just strictly looking at your CBC, which shows your red and white blood cells. And particularly what they're interested in is your hemoglobin levels. So if they just run your CBC, if your hemoglobin looks normal, they might just tell you, oh, your iron's normal. And then you leave their office thinking you've had your ferritin or iron run, when in fact you haven't. Now, in my world, what we do, we always run the CBC and then we run your ferritin as well. And the ferritin's reference range as far as like lower and upper limits, lower is 15, upper is in the 200s. So for a female to have 0% chance of being symptomatic from an iron deficiency, she would have to have a ferritin of between 80 and 100, which any female that comes into my office saying that they're fatigued, there's always a reason. And ferritin often is related to this fatigue. And fatigue is one of many symptoms that iron deficiency can come along with, but we'll just use that as the example. So I've had women roll into my office. They've had ferritins of 50. They've had ferritins of 30. They've had ferritins of 15. They've had ferritins of 9. I've even seen ferritins of 3. No joke. And in all of these different levels, all of these women that I've seen have been told that their ferritin is normal. So how do we know if this is impacting us in a negative way? If our goal is to shoot for between 80 and 100, what I can say is that if you had a ferritin of 100 and we knew for sure that's what it was, there's 0% chance that any of your symptoms would be related to a low ferritin. Now, if you had a ferritin of 50, what I would say is there's a 50% chance that some of your symptoms are related to low iron. If you have a ferritin of 30, there's a 70% chance that some of your symptoms are related to your low iron. So that's usually how I explain this to patients. Now, there's one other factor that we need to consider when we're interpreting your ferritin levels, and that is a marker of inflammation called CRP, or sometimes we're using ESR. So if we're using CRP as the example, C-reactive protein, this is something that will rise when we have something acutely going on that's driving a big inflammatory response. So I generally test CRP with ferritin, and here's why. When you have a high CRP, and we're going to use the number of 10 as the example, so CRP of 10, that will actually drive your ferritin levels up by almost 50% or more. So let's say you have a CRP of 10 and you come into my office and your ferritin is 100. What I know is that that ferritin is also acute phase reactant. It goes up when inflammation goes up. So it's actually like a false reading as far as using that to assess if your iron levels are sufficient. So if CRP is high, but you have a ferritin of 100, I would argue, and what the research shows is that your actual ferritin is probably without inflammation sitting at 50, maybe even lower. So again, that still puts you in an area where you could be symptomatic from your iron levels. So that's a little bit about iron levels, how we interpret them, what is normal, what is not normal. So you have a bit more of a context when you go into your GP's office. The biggest piece is you actually just getting a copy of those records so you can visually see with your own eyes. Because if a doctor's just telling you everything's normal and they're sending you on your way, but you actually don't know what those numbers look like, you have no reference to say like, was it actually normal? But I will say this, if you're ever going to see a doctor for anything, let's use fatigue as the example. If you leave and they say everything's normal, but you're feeling a certain way, run with that. Something is off, something isn't right. Just seek support in a way where someone will listen to you and help you get to the bottom of why. All right, that's it for today. If you got any useful information out of this video, definitely hit the like and subscribe button, and we'll see you soon.